Dear students, this is our seventh lecture on medicinal chemistry, and today we will discuss what are cardiovascular drugs. And out of these cardiovascular drugs, most important ones they are antihypertensive drugs, and our main focus in this lecture will be antihypertensive drugs. Now, as you know, that cardiovascular disease is world's number one killer disease, and these are basically a group of disorders of heart and blood vessels, which are commonly referred to as heart disease or stroke. And every year, data has revealed that about 18.6 million deaths they are caused because of cardiovascular diseases, and this 18.6 million constitutes about 33% of all the global deaths which take place due to various diseases, and more than 75% of cardiovascular deaths take place in lower or middle income countries. And the types of these cardiovascular diseases, they may be because of coronary artery disease, they may be due to the disease of the valves which are present in our heart, or aneurysm effect may be there, that is aortic artery is affected. Then cardiac arrhythmia may be the reason for CVD. Then cardiomyopathy can also be there because of that thickening of these walls of the heart may take place, which can lead to cardiomyopathy. Then pericarditis, that is because of the inflated pericardium. There is the inflation at this point of the heart, that is pericardium. Then because of dilated ventricle, the heart failure can also occur. And the reasons are mainly sometimes because of our lifestyle, which may cause the say fatty deposits in the various parts of our blood vascular system, and which will lead to coronary artery diseases. Then after this COVID-19 also, there is an increase of CVD, that is there is systemic inflammation of various types which is there, and then heart gets infected directly by the viruses. That has also caused various types of cardiovascular diseases. It may lead to cardiac injury, it may lead to stroke, it may lead to myocardial infarction, then arrhythmia may take place, and thromboembolism can take place. And because of all these diseases, our heart is affected. Now, if we go through the recent health report of 2022, it has been estimated that as far as annual deaths in India due to non-communicable diseases is concerned, 26% is because of CVD, 2% because of diabetes, then 13% for respiratory diseases, 7% for cancer, and then 28% for communicable, maternal, parenteral or nutritional diseases they are there. And 12% are due to some injuries, and other non-communicable diseases, they are about 12%. So you can see that isolably the cardiovascular diseases are very high in India also. Uh, and this is again comparable to cardiovascular diseases globally. The percentage is almost same. Now these heart diseases may be due to different seasons, because the metabolism also varies with seasonal temperature variations around an annual year. Then accordingly, because of pollution also, there may be some cardiovascular diseases, and depending upon whether it is winter or it is summer, there are different factors which can lead to variation in the metabolism, which causes the various types of cardiovascular diseases. Now, to cure these CVDs, we use many types of drugs, and these are called as cardiovascular drugs. And these cardiovascular drugs, they may be classified into these four types. First is cardiac glycosides. Second is antihypertensive and hypotensive drugs. Antiarrhythmic agents or antiarrhythmic drugs, then vasopressor drugs. So we will discuss all these cardiovascular drugs one by one, and how these are synthesized, that will be also discussed in the subsequent lectures. So first is cardiac glycosides. Cardiac glycosides, they are class of drugs which are commonly derived from foxglove plant, such as Digitalis lanata or Digitalis purpurea. And the most commonly prescribed the cardiac glycoside is digoxin. This is the structure of digoxin. The basically, the general structure of cardiac glycoside consists of a steroid molecule having these four carbocyclic rings A, B, C, and D. As we know that steroids are of this structure, and then at three position, these are having a attachment of a sugar molecule, and then at this point we are having R molecule, and these molecules, R molecule may be methyl hydroxyl or aldehydic group or a complex group. The R and which is present mostly in cardiac glycosides, they may be of two types, that is one is having cardinolides if R is a 5-membered ring with a single bond at the lactone end. Similarly, if it is called as dienolide and bufadienolide if it is having a 6-membered ring with 2 double bonds at the lactone end. Now, for example, in case of digoxin, we can see that this is a 5-membered ring with a single double bond at the lactone end. Hence, the digoxin can be classified as cardinolide cardiac glycoside. Now, the use of these cardiac glycosides is for the treatment of congestive heart failure, which is a chronic condition in which heart does not pump blood as well as it should be. Then these cardiac glycosides, they can also be used for cardiac arrhythmia, that is an irregular heartbeat. So all these types of cardiac glycosides, they are very effective against these two types of cardiovascular diseases. Then second category of drugs which are most common, they are antihypertensive drugs. And these antihypertensive drugs are used to treat hypertension. Hypertension means any patient which is suffering from high blood pressure, and you can say that under normal circumstances there is a fixed blood pressure of the body, and if it increases from that normal value, we say that the person is suffering from high blood pressure, and if it decreases from that value, we say the person is suffering from low blood pressure value. So antihypertensive drugs are to treat hypertension, that is high blood pressure. So you can imagine that the hypertensive drug can decrease the blood pressure, and decrease of blood pressure even by 5 mm of Hg can decrease the risk of stroke by 34%, and risk of CVD, that is cardiovascular disease, that heart disease, by 21%. And then the use of antihypertensive also reduces the risk of dementia, heart failure, and mortality for the patients who are suffering from cardiovascular diseases. And there are different types of antihypertensive drugs which can be used depending upon the type of cardiovascular disease the patient is having. First category is diuretics, second is calcium channel blockers, then ACE inhibitors, then angiotensin 2 receptor antagonists, ARBA, RBs, then beta blockers and vasodilators. Now we will discuss these one by one. Diuretics are those antihypertensive drugs which are used to help kidneys eliminate excess salt and water from the body tissues and the blood to reduce the blood pressure. Now these diuretics, they may be of these four types: loop diuretics, thiazide diuretics, thiazide-like diuretics, and potassium-sparing diuretics. The loop diuretics, they are more effective in patients with impaired kidney function. So the patients which are not having the kidney functional properly, they are given the loop diuretics, and common examples of loop diuretics are bimetridine, furosemide, and torsemide. All these types of synthetic compounds having this structure, and in most of these you can see these functional group: carboxylic acid, sulfonamide, secondary amine, ether. So here also carboxylic acid, ether, alpha beta unsaturated ketone, here amines, carboxylic acid, sulfonamides. So basically these are the function group which are active against the anti they are used as antihypertensive drugs. Then are thiazide diuretics. These are both a class of sulfur-containing organic molecules and a class of diuretics, where we will see that there is a presence of benzothiazide ring in the molecule. So this is benzothiazide ring present in the molecule, which are called as thiazide diuretic. So this is the main functional groups which are active as drugs for patients of hypertension. Then examples of these are these five types of compounds. They can be used as thiazide diuretics, epithiazides, chlorothiazide. All these five types, they are covered or classified under thiazide diuretics. Then diuretics which are similar to thiazide. These are basically sulfonamide diuretics, but they will not be having benzothiazide uh, ring present in the molecule, but they will be having sulfonamide moiety present in the molecule. You can see all these are the examples of thiazide like diuretics, and all these they have similar properties like thiazide diuretics, but they are lacking this benzothiazide ring, but they will be having this sulfonamide group present in them. So this is the basic requirement for these types of diuretic compounds, that they will always have sulfonamide group present in the molecule. Then fourth category is potassium sparing diuretics. These are the drugs that cause diuresis without causing potassium loss in the urine. So these are, we can say, a selective type of diuretics which are used based on the specific disease of the patient. And these are the types of compounds which are used for uh, removing the infected urine in the body of a patient. Amyloride having these types of pyrazine ring structures, triametrine, then spironolactones. These are basically steroidal structure having this lactone at the one end of the molecule, and these again they are also steroidal lactones which can be used as drugs for diuresis. Then next is calcium channel blockers. These are the compounds which are used as drugs to decrease blood pressure in patients of hypertension. These are called as calcium channel blockers or calcium antagonists or calcium channel antagonist, and they disturb the movement of calcium through calcium channels in the patients, and they are particularly effective against large vessel stiffness. If in the patient large vessel is stiffed, then these compounds can remove that stiffness by making it a disease-free large vessel. So the use of these CCBs will be elevated systolic blood pressure in elderly patient, that is because of the stiffness in the large vessel of the patients. These can further be categorized into different types of synthetic compounds, which may be dihydropyridines or non-dihydropyridines. The non-dihydropyridines can further be classified into phenylalkylamines, benzothiazepines, and non-selective compounds, and some other types of synthetic compounds which can be classified under non-dihydropyridine category. So first is dihydropyridine. So this type of ring is called as dihydropyridine. So any synthetic compound having this ring comes under these types of antihypertensive drugs having dihydropyridine ring. So they are derived from, as I told you, this ring dihydropyridine, and they are used to reduce systematic vascular resistance and arterial pressure. So this will reduce the pressure in the arteries by using this amlodipine, clevidipine, menidipine, epidipine, amlodipine, and falodipine. All these are having one thing in common: the presence of dihydropyridine ring. Then non-dihydropyridine derivatives which can act as CCPs, they are phenylalkylamines. So these types of compounds, they are called as phenylalkylamine. So this is a secondary amine, whereas verapamil is a tertiary amine compound having an aromatic and alkyl chain. Phenylalkyl amine calcium channel blockers. They are relatively selective for myocardium. Then they can reduce myocardial oxygen demand, and they can reverse the coronary vasospasm. And they are also used to treat angina pain in the patients. Then benzothiazepine, this seven-membered ring is called as seven-membered ring having a benzene ring attached to it. This is in toto called as benzothiazepine ring. So any compound having this ring, for example, in this case, diltiazem is acting as a CCB under non-dihydropyridine derivative. So benzodiazepine calcium channel blockers, they are the compounds. This is intermediate class between phenylalkylamine and dihydropyridines. In their selectivity for vascular calcium channels, and they can act both as cardiac depressants and vasodilator drugs. Then non-selective non-dihydropyridine calcium channel blockers, they are selective in nature, and they will have a different structure. Each will have a different structure. For example, mibafredil, this is benzimidazole structure, is the active ingredient in this to act as the drug. Then in this case, piperazine ring, and here the again amide linkage will act as the functional group which is active against the CVDs. Then some more other type of CCBs, gabapentinoids such as gabapentin and pregabalin. These are the two drugs which can be used as CCBs, and they are selective blockers of alpha to delta subunit containing voltage gated calcium channels, and they are primarily used to treat epilepsy and neuropathic pain in the patients. Similarly, zicanotide, this is a natural peptide compound, and this again is a selective calcium channel blocker which is used for blocking N-type calcium channels, and this is also having potent analgesic properties which are approximately 1000 times more than that of morphine. We compare the analgesic properties of this compound zicanotide and the morphine. Zicanotide is 1000 times more potent than the morphine. Then there are other naturally occurring compounds and metallic compounds such as magnesium. They can also act as calcium channel blockers when they are administered orally to the patients. The next is ACE inhibitors or angiotensin converting enzyme inhibitors. They are the class of drugs which are mainly used for the treatment of high blood pressure and heart failure. And their function is they will relax the blood vessels as well as they will decrease the blood volume in the heart. So because of the decrease in blood volume and relaxation of the blood vessels, the blood pressure will decrease, and similarly the oxygen demand of the heart will also decrease because of these two reasons, and the patient can be treated by giving these ACE inhibitors. These inhibitors, they will inhibit the activity of angiotensin converter enzyme, which is an important component of renin-angiotensin system, which will convert angiotensin 1 into angiotensin 2, and it will hydrolyze bradykinin, which is a peptide that promotes inflammation. So use of these will hydrolyze bradykinin mainly, and patient will be treated. This is bradykinin, which is present in the renin-angiotensin system. Then these ACE inhibitors, they can be easily recognized by their common suffix, which we use is pre. There can be three different types of function groups present on the molecular structure of these ACE inhibitors, and based on these groups they have been classified as sulfhydryl containing agents where sulfur is present, phosphenyl containing agents, and carboxyl containing agents. So you can say sulfhydryl containing ACE inhibitors, phosphenyl containing ACE inhibitors, and carboxyl containing ACE inhibitors are there. So these are the structures of different types of ACE inhibitors. For example, sulfhydryl containing agents. The first ACE inhibitor under this category was captopril. You can see that the presence of this thiol group is because of which we classify them as sulfhydryl containing agents. Then alipril, again this sulfur is present. Then zofinopril, again sulfur is present. Then second category is phosphenyl containing agents, and there is only one example, phosphinopril, and phosphorus is present in this. Then carboxyl containing agents, there may be mono or dicarboxyl containing agents. So you can see over here carboxylic acid is present. Here one of the carboxylic acid is converted into ester. Here also one ester, one carboxylic acid, ester, carboxylic acid. So in all these we can see that we are having a carboxylic acid and ester derivative. That is why they are called as dicarboxylic acid. And here in this case both are carboxylic acids. Then is ARBs, angiotensin 2 receptor antagonists. These ARBs, they formally block the angiotensin receptor or angiotensin 2 receptor antagonists. They are the group of compounds that will inhibit the angiotensin 2 receptor type 1 and block the arterial contraction. They are mainly used for the treatment of high blood pressure, kidney damage due to diabetes, and congestive heart failure. And what they do is they will selectively block the activation of AT1, that is angiotensin 2 receptor type 1, by preventing the binding of angiotensin 2 compared to ACE inhibitors. So they are more selective in comparison to ACE inhibitors. And both ARBs and ACE inhibitors, they are indicated as first line antihypertensives in the patients which are developing hypertension along with the left side heart failure. But the adverse effects of ARBs are less in comparison to ACE inhibitors. So we can say that ARBs, they are more effective in comparison to ACE inhibitors. So these are some of the examples of ARBs, and telmisartan. This is the most common example and most commonly used ARB for hypertension patients. Then losartan, irbesartan, olmesartan, candesartan, famosartan, valsartan, isalsartan. All these, they have similar structure. For example, in case of telmisartan, we are having a benzimidazole rings which are responsible for the activity of the drug. Whereas in case of losartan, we can say there is a tetrazole ring and imidazole ring which are responsible for the activity of these compounds. In irbesartan, again imidazole and tetrazole ring. In this case, tetrazole ring, imidazole ring. Here also tetrazole ring. Here also benzimidazole ring and imidazole derivative. Tetrazole again. Here also tetrazole. So most common functional group which are present is this heterocyclic unit tetrazole, which is commonly present in almost all the ARBs. The next is beta blockers. Beta blockers, they are generally used to manage abnormal heart rhythms, and they protect the heart from a second heart attack after the first heart attack has been taken place. So that means we can say beta blockers, they are used for secondary prevention, and they act as antihypertensive drugs, and they will lower the high blood pressure in the patient. The beta receptors, they are found on the cells of heart muscles, smooth muscles, airways, arteries, kidneys, and other tissue that are part of the sympathetic nervous system, and they lead to stress responses, especially when they are stimulated by epinephrine. Then basically beta blockers, what they do is they interfere with the binding of the receptor of epinephrine and other stress hormones and weaken the effects of stress hormone. So when the effect of stress hormones is weakened, then blood pressure will become low. or we can say the high blood pressure will be reduced to normal blood pressure. And then the first clinically significant beta blocker which was released in the market was propranolol. This was synthesized in 1964 by James Black, and it is considered as one of the most important contribution to clinical medicine in 20th century. So this is the structure of this beta blocker. Propranolol having this hydroxyl group and this secondary amine, which are responsible for the activity of this drug. The beta blockers, they are not effective as diuretics or ACE inhibitors or calcium channels. These diuretics, ACE inhibitors or calcium channel blockers, they are more effective in comparison to beta blockers. Then these can be classified into different types of compounds or agents: non-selective agents, beta 1 selective, beta 2 selective, beta 3 selective agents, then beta 1 selective antagonists and beta 3 agonist agents. The non-selective beta blockers, they will display both beta 1 and beta 2 antagonism, and these are the different types of compounds which can act as non-selective beta blocker agents. So in most of these we will see that the hydroxyl group and secondary amino group hydroxyl group. So these are the active functional groups which are present in the non-selective beta blocker agents, which are responsible for the action of the drug on different diseases. Then beta 1 selective agents, these are also called as cardioselective agents. Acetylol, atenolol, metoprolol, these are also very commonly given antihypertensive agents in patients of high blood pressure. Caliprolol, asmolol. So these are also having the same type of structure with different type of substituents present, which will vary the activity of these different types of beta 1 selective agents. Then beta 2 selective agents are butaximine and this ICI 118551. Again, these are having the same functional group, hydroxyl and secondary amino, but in addition, these substitutions, they are responsible for the beta selectivity of these beta blockers. Then beta 3 selective agents, this is the structure of the compound SR59230A. Then nabivolol is beta 1 selective antagonist and beta 3 agonist agent. Again, here also hydroxyl and secondary amino group present. In addition, these functional groups, they are responsible for the selectivity of these beta blockers. Then is vasodilators. Vasodilation is basically widening of the blood vessels by relaxation of smooth muscle cells within the vessel walls. So this will happen particularly in large veins, large arteries and small arterioles. This process is opposite to what we have seen vasoconstriction, that is narrowing of blood vessels, which will increase the blood pressure. Vasodilation will increase the flow of the blood due to decrease in vascular resistance. Therefore, dilation of arterial blood vessels decreases the blood pressure. So these vasodilators, they are used for the opposite action which we have seen in case of high blood pressure antihypertensive drugs, which reduce the high blood pressure to low blood pressure. Whereas these will be used to increase the blood pressure, because now the uh, these substances or drugs, they will cause vasodilation. They are termed as vasodilators. Uh, and these are some of the examples of vasodilators: adenosine, hydralazine, diazoxide, then sodium nitroprusside. This is the oldest known vasodilator. Prostacycline, all these they are effective vasodilators. Then hypotensive drugs. Hypotension is low blood pressure. This is opposite to hypertension. So any blood pressure that is below normal value than expected for an individual in a given environment is called as hypotension. And this hypotension may be due to neurologic conditions or non-neurologic conditions. So neurologic condition may be changing position from lying to more vertical. Then because of stroke, this can lead to a low blood pressure. Then because of shock, then lightheadedness after urinating or defecting, that may also cause lowering the blood pressure. Parkinson's disease may also cause the lower blood pressure. Neuropathy or simply fright can also lead to low blood pressure. So all these conditions they are termed as neurologic conditions, whereas non-neurologic conditions may be bleedings, infections, dehydration, heart disease, adrenal insufficiency, pregnancy, prolonged bed rest, poisoning, toxic shock syndrome, blood transfusion reaction. All these conditions, they can lead to non-neurologic condition which can cause the low blood pressure. Uh, the hypotensive drugs, they include blood pressure drugs like diuretics, heart medication, calcium antagonist, nifedipine, procardia. Then beta blockers, they can also be used. Propranolol and indirel. Then depression medication can also be used for increasing the blood pressure in hypotensive patient. Then alcohol can also be used to increase the blood pressure. These are the references which have been used for preparing this lecture. Thank you very much.